Personal Nursing Philosophy by Haley Woodward, Queen's University of Charlotte, Fall 2019. My personal nursing philosophy is that my practice must always stem from a place of compassion, patience, and understanding. It is my responsibility as a nurse to provide safe, holistic, patient-centered, and evidence-based care to every individual that I have the privilege of caring for. In order to begin fully conceptualizing my personal philosophy on nursing, I began assessing my beliefs as they relate to the formative paradigms of nursing. As defined by Smith and Parker, the four domains include humans, health, environment, and nursing. Humans encompass any patient that requires nursing care. They should always be listed first because without the patient, what really is the point to being a nurse? Everything we do relates back to the patient we're caring for, so it's only appropriate that they take center stage in any personal nursing philosophy. Health is a state of well-being. However, as nurses, we need to acknowledge that health holds different meanings to different people. Someone with a chronic illness may or may not have a realistic expectation for their health, and it's my responsibility as a nurse to discover the patient's individual meaning of health and help them to attain realistic goals related to their health status. Environment is any space with which nursing care is conducted. Florence Nightingale was a fierce advocate for maintaining an environment conducive to healing, and I think this sentiment still rings true today and is a concept that I find value in as well. Nursing encompasses all the tasks that nurses do in order to provide care for patients. However, I believe it's a disservice to define nursing simply by the tasks that need to be completed. Certainly, a nurse needs to have extensive scientific knowledge and technical skills, but nursing is also so much more than this. A nurse is a role model, a leader, an educator, and for many patients, we're their only confidant. This is such a unique position in healthcare, and our role shouldn't be taken lightly. I think Virginia Henderson would agree with this assessment because while she advocated for nursing care to remain in the realm of nursing to preserve our professional domain, she was also an advocate for the concept of nurses to get under the patient's skin, so to speak, in order to supplement their strength, will, or knowledge according to their needs. Again, this is something unique to nursing and something I think we undervalue more often than not. So what guides my practice? In order to define that, I needed to understand how I value knowledge acquisition and then place it within a theory construct that I relate to. In post-positivist approaches to research, Anne Ryan defines epistemology and what forms one's epistemological base. For me, I find value in both positivism and post-positivism approaches to knowledge acquisition. Positivism values the scientific method and keeping research separate from the ideological influences of the researcher. This is useful to nursing because we need to have a solid scientific foundation in order to adequately manage disease processes. However, I also find that there is value in post-positivism. Post-positivism recognizes that there are drawbacks to disregarding theory for the sake of raw data. In many ways, post-positivism is more holistic because it considers subjective states in multiple perspectives rather than constraining itself to seeking one universal truth. Having a healthy appreciation for both concepts is essential for my nursing practice because it places me in a position of duality to best serve my patients for every aspect of their care. Understanding the different ways of knowing is important to understanding how my nursing practice is being guided at a conceptual level. Primarily, I would classify myself as being empirically driven in my way of knowing. I tend to be suspicious of new initiatives or policies that lack objective and measurable evidence to support their implementation. I find that I do lean on ethical knowing as well. Ethical knowing concerns itself with beliefs and values, particularly moral and ethical obligations. As a nurse, I always want to do what's right for my patient and their unique situation. Weidenbach's prescriptive theory resonates with me. Weidenbach believes that the central purpose of nursing is for the nurse to be a facilitator and central motivator for patients to overcome obstacles in their way. I think this is something many of us can agree with and a concept that will be around in the nursing profession for the foreseeable future. These are just some of the methods that can provide metrics to measure the performance of my nursing practice. Evidence-based practice is a big one. Direct patient feedback is also very useful. Quality improvement initiatives help to improve my practice as well. While speaking directly to patients is wonderful, QI projects help us to objectively measure the effectiveness of broad changes and to assess how effective these changes are when applied to the general population, whether or not they're worth continuing. A few things that I think could make practice more meaningful are nursing recognition initiatives and continuing education for ongoing professional growth. As Smiley points out, nurses that achieve higher levels of professionalism are often the ones that participate in continuing education. Selecting continuing education courses as they relate to the nurse's individual interests, I think, is also really important because exposure to new ideas and concepts is invigorating and creates a sense of autonomy and confidence in the care that we can provide our patients beyond just what the facility mandated yearly competencies and untailored educational offerings can inspire.